Hi, this is Dr. Steve Pike, and today I'd like to talk with you a little bit about thumb sucking and pacifiers. First thing I'd like you to know about these kind of sucking habits is that some kids find it very soothing to suck their thumb or suck their pacifier, and this is a very important coping mechanism, and it allows kids to process stress in the world. So getting a child who doesn't want to stop, getting them to stop can be a very difficult process in some situations. Does it cause harm to the teeth? Yes, it will constrict the upper jaw, depending on how hard you suck, and it will push out the upper front teeth. Now, it's important to realize that the shape of the upper jaw is determined by the tongue putting pressure on the teeth and the lips and cheek putting pressure in the other direction. So when kids are young, they're very malleable, and if they stop the thumb sucking or pacifier habit at a young age, everything will go back to normal. If they stop at, say, age 6 or 7, it's a little bit more difficult to bring everything back to the shape that it would have been. There's no absolutes with this, but by age 4, you certainly want to be, it's best if the habit is on its way out. The technique that I would recommend to break this habit is to have a conversation with your child. In this conversation, you can say, what do you think that this thumb sucking or pacifier is doing to your teeth? Oh, okay. And then, yes, it's constricting the upper jaw and it's pushing out your teeth, and then it'll make it so you might fall down, and if you fall down, you might hit your front teeth. Then you can ask them to create a solution. Oh, okay, so it's causing this problem. What do you think we should do about it? And then they'll come up with a solution. You can say, and you can give them nudges in the right direction. Should we give your pacifier to the pacifier fairy? Oh yeah, what a great idea. And then you pick a time, and then you can give it away. And some people will tie it onto a balloon and then let the balloon float off. That's a very nice way to do it. And that gives the kids a little bit of control over the process so they don't feel as bad about it. Many kids are very attached to these habits, and if you just spring it on the child one day and say, okay, we're going to stop this as of today, then you're likely to be met with a lot of resistance. But if you give your child time to process this, it tends to work out more easily for everybody involved. So you can say, okay, you're 3 years old now. When you're 3 and a half, you can't use it in the car anymore. You can only use it in bed. So you're giving them time to think about it, and you're setting a firm deadline, and then you're whittling away at the habit. If you have any questions about this, please feel free to give us a call. We'd love to talk more about it.